we are going to study about the another oral hypoglycemic drugs, or in which we mainly see about the DPP-4 inhibitors. And before going to the DPP-4 inhibitors, we can first understand what is the normal role of the GLP and how this GLP-1 and the glucagon like peptide is mainly related to what DPP-4. Okay, and first understand what is the normal role of the L cell or normal function of the GLP, and how does this DPP-4 works, or DPP-4 inhibitors can works. First, what is the role of the GLP? This normally GLP-1. Okay, so first understand, if the person can take glucose, and this glucose when reached to the intestine, the L cell of intestine normally, due to what normally this L cell of the intestine amplify the glucose induced insulin release, means they can release insulin due to the presence of what, due to the induction from the glucose. And if this glucose can induce the L cell, it can release what, GLP, and this GLP is responsible for activation and deactivation, mainly activation of insulin and deactivation of glucagon. It means what, this normally the function of the insulin is to decrease blood glucose level, and glucagon is to increase blood glucose level. But if it can get inhibited, this is responsible for what, if it can get deactivated and the insulin can get activated, it is normally responsible for what, decreasing of blood glucose level. Okay, the main is to decrease blood glucose level, and this is the main target in the diabetes mellitus type 2. But the problem is that if the patient, if in the diabetes normally what, or in the normal way, normal physiological, this GLP-1 can fastly deactivated by the enzyme known as DPP-4, okay, and can convert into peptides. Okay, and for the treatment sake, for the treatment point of view, in the type of the diabetes mellitus type 2, we want to what, increase the GLP-1 to induce what, this type of function like the activation of insulin or the deactivation of glucagon to treat the patient of the diabetes. And for this, our scientists can produce or can develop the DPP-4 inhibitors for this type of problems. And if this DPP-4 inhibitors can be invented, it is responsible for what, deactivation or this step. And if this step is deactivated, it is responsible for what, increase of more GLP. And if this more GLP is there, the normal function of this can be happened. Okay, and the blood glucose level can be maintained during this condition. But the problem, we can understand what are the drugs included in this DPP-4 inhibitors. Mainly you can learn in a single step, like DPP-4 inhibitors mainly responsible for increasing the GLP-1, okay, and if this GLP-1 can be increased, it is responsible for decreasing what, normally you can learn like DPP-4 inhibitors mainly responsible for increasing what, GLP-1, and if this GLP-1 is increased, there will be more activation of beta cell to release insulin, and if there is more release of insulin is there, it is responsible for decreased blood glucose level. And what we want to. Okay, and this is our main target in the diabetes, to decrease the blood glucose level. And what are the drugs included in this group? And in this group we have the sitagliptins, like the name ended with gliptins, vildagliptins, saxagliptins, allogliptins, and the linagliptins are there. Okay, and these are the important drugs, or we can mainly use in combination, or separately we can use this type of the drugs. But the problem of this having a drugs like this the main adverse effect of this drug is the nasopharyngitis, or the upper respiratory tract infection. And the major, like, this is responsible for this nasopharyngitis, mainly responsible for the most common side effect is nasopharyngitis, or you can say upper respiratory tract infection, mainly responsible for this. And also it is mainly associated with acute pancreatitis. And also we can earlier study about the GLP-1 agonist, which are some of the drugs are also responsible for the acute pancreatitis in that group. Okay, and we can also mainly the dose adjustment is required in the several, in the renal failure. But you can learn this, like, only this linagliptin is exam point of view. You can learn like linagliptin is safest in what? Renal failure, means it does not require any dose adjustment. But these groups or these drugs require the dose adjustment during the renal failure patient, and that's why they are mainly contraindicated or in the renal failure patient. Okay, and other understands, like, the mainly we can understand the side effect. And in the side effect, the most common side effect is the nasopharyngitis, or the upper respiratory tract infection. And the other, they are also mainly associated with which type of the disease, like the acute pancreatitis. Okay, and some of the drugs, like, mainly you can understand, like, all of the DPP-4 inhibitors are mainly contraindicated or require a dose adjustment. Not contraindicated means you can say require dose adjustment. Dose adjustment in what? In renal failure. Exception, only one exception you have to learn, like linagliptin. This is the important one. Okay, and the other, some of the DPP-4 inhibitors are also responsible for the hepatitis, and which may also cause hepatitis. And these are like vildagliptins. And these vildagliptins are mainly causes what? Hepatitis. And also it can cause what? Renal failure. It may also cause renal failure. So they are mainly contraindicated in this disease, like liver or kidney disease. Okay, and at last we can like the linagliptins and also the saxagliptins. These groups of the drugs, like linagliptin or the saxagliptins are mainly contraindicated in where? Heart failure. These are mainly contraindicated in where? Heart failure. Okay, and thanks for watching, and please do subscribe and like my channel, and share with your friends. Thank you.